Hello, everyone. My name is Luke Ferrari, and I am a district manager with BioTE Medical. I'm pleased to be joining Dr. Lorraine Diego, who is a practicing physician and GYN in Los Angeles. Our presentation today, How Something Small Can Make a Big Difference, will be regarding health and hormones. A few housekeeping items before we get started. We will be taking questions at the end of the presentation. There's a box at the bottom of the screen that says Q&A. If you click on that, you will be able to type in any questions that you may have, and we will address as many questions as possible at the end of the presentation. And with that, I will pass the mic to Dr. Diego.
Hello, everyone. Hello, Luke. Thank you, everyone, for joining us today on our talk about hormones and how it makes an impact on our lives and how hormonal imbalance impacts us as we age and what we can do about it. So let's go right into the presentation because I respect everyone's time. So what are hormones and why are they important, and what is hormonal imbalance? So hormones are chemicals that coordinate different functions in your body. They carry messages throughout your body to your organs, skin, muscles, and tissues. They're made in one part of your body called endocrine glands, and they travel through the bloodstream to target organs, and they tell your body what to do. They control your heart rate, your sleep cycles, your sexual function and reproduction, your appetite, your growth and development, mood and stress are all affected by hormones. So again, they are made in one part of the body and they travel to the end target organs where there are certain receptors that are specific for that certain molecule. So the molecule fits tightly like a lock and key. So like example, insulin is made in the pancreas, but then it goes to the different muscles because the muscles have these insulin receptors. So when we age, basically, do we age because we've lost our hormones, or did we lose our hormones because we aged? So for hormonal imbalance usually occurs when women enter menopause and men enter what's called andropause, or humorously, they also call it menopause. It may occur at younger ages, though, in certain special circumstances that can cause premature menopause, like physical or mental trauma, cancer treatments like chemo or radiation therapy, and severe illnesses. But again, most of us do recognize that when you talk about hormonal imbalance, it seems to come around during our midlives, during late 40s and early 50s. So signs of hormonal imbalance tend to be they can be mental, so feeling tired all the time, fatigue, mood swings, anxiety, lack of sleep causing us to have poor memories. We feel down and depressed, may not be clinical depression, but definitely a little bit of feeling despondent, and brain fog, hot flashes, night sweats, etc. So if you're like me and we're in the during our midlives, these symptoms are definitely something we're becoming aware of. So again, hormones can either impact us to look like this. When I saw this picture, basically they look so worried, so anxious, so constipated. Or basically your hormones can help you feel like this. Again, when you feel like you're just on your A game, that your mind and your body seem to be in sync. And then if you feel well, of course, your relationships will also go well. So although I am a gynecologist, I will give a few words about men because I know menopause or andropause can also affect men quite adversely. And since men are more shy to talk about their problems tend to be more underdiagnosed. So I just want to give a few minutes to that. So basically, male menopause happens when their bodies fail to produce their sufficient hormones, so especially testosterone, to the point where they feel mental and physical decline, just like their female counterparts, but in our phase known as menopause. So again, 20% of men over 50 have diagnosed low testosterone. And of course, if you're having more chronic diseases like diabetes, high blood pressure, and sleep apnea, they will have a more significant andropause or menopause phase. So testosterone is, again, talking about men, testosterone is the most important sex hormone in men. More than 95% of their testosterone is produced in their testicles in response to LH hormone, which is made in the pituitary. So in females, testosterone is produced in the ovaries and the adrenal glands and is actually one of several male sex hormones that we make. So facts about testosterone. When you think about testosterone, try to think of BBH, bones, brain, and heart. Testosterone is basically very important in those functions. So again, testosterone is in both men and women. Men tend to have 10 times more of the amount of testosterone as women. And starting in their mid-30s, they start losing about 1 to 3% of testosterone production per year. And women, actually it starts in the mid-20s, and we can lose actually up to 50% per year. So this slide is just to show that when your testosterone level is low, whether you're male or female, it is associated with disease, increased disease and mortality. Not if, it is associated with increased disease and mortality. So it's almost like, fine, you have low testosterone, you're almost like, you're now vulnerable to so many diseases. We're talking dementia, type 2 diabetes, and metabolic syndrome, just hyperlipidemia, fatigue, decreased libido, cancers, and the dreaded erectile dysfunction or ED in men. So let's now go back to women. So for the rest of the talk, I will be mostly focusing on women's health, just because that is what I know more of. And of course, I'm experiencing it along with my patients. So menopause is the time that marks the end of your menstrual cycles. You're technically considered menopausal when you've gone through 12 months consecutively without a menstrual period. So in the United States, the most common age range for this is 48 to 55 years old, but the average age is 51.2 years old. Premature menopause is defined as menopause occurring in women less than 40 years old. So that is in 1 to 2% of women. And between the ages of 40 to 45, if you have a menopause at those ages, it's considered early menopause, which is 5 to 7%. So there are 3 stages of menopause. So perimenopause is the time leading up to menopause. So the North American Menopause Society states that this could usually last 4 to 8 years. A lot of women seem surprised when I say that, but yes, it can last that long. And in some unlucky women, it can actually last almost up to 15 years or starting in the mid-30s. So perimenopause describes a time when hormones start to decline and menstrual cycles start becoming erratic and irregular. You start to experience those symptoms of menopause, like hot flashes, poor sleep, mood swings, or vaginal dryness. The factors to note regarding perimenopause, there are some factors that actually cause your menopause to start earlier than you would think. Or these are the factors that would affect what age you will start your menopausal symptoms. One is your mom's age at menopause. This is pretty much a good, a sign of when you will expect to have menopause. And if they had a rough transition into menopause, then most likely you might as well. Ethnicity, women of color tend to begin perimenopause and menopause at earlier ages than white women. And the earlier the start of perimenopause at a younger age, the longer is the perimenopausal period and the more symptoms you will feel, like hot flashes. Another thing is that if you do have these menopausal symptoms like hot flashes at a younger age, it's actually associated with increased heart disease. So please take those hot flashes seriously. Please seek, medical attention, and it should not be blown off like you just think, oh, I just need a fan, or I just need to, dress in layers. Actually go in and maybe consider having a heart workup. Other things, smoking tends to bring on menopause an average about 5 years sooner than in non-smokers. So, and then alcohol level. But some people might think that because you're maybe drinking more alcohol, you have more stress in your life. And then that could be a reason why you're having menopause at a younger age. Educational level. Women who've actually have more education tend to go through menopause later. And then lastly, I thought this was funny. Women who have sex at least once a week are less likely to have menopausal symptoms compared to women with sex less than once a month. So anyway, I thought that was funny. Okay, going on to the second stage of menopause, it is when you've stopped producing the hormones and your menstrual period has now been absent for 12 months in a row. Once this has occurred, you have now entered the third phase called postmenopause. So once this happens, you're pretty much postmenopausal for the rest of your life. So, all right. This is a quick slide I wanted to talk about menopause and heart disease. So again, testosterone protects BBH, bones, brains, and hearts. So we don't hear about heart attacks in younger women, but unfortunately, we do hear about heart attacks occurring in younger men, like late 30s and 40s. So what is happening is that the estrogen and testosterone in women help protect us against heart disease, which is the #1 killer of adults, male and female. Thus, after menopause, when we do lose our testosterone, women really need to start watching their cardiac risk factors just like men, because we just can't get away with poor decisions anymore. So that means we need to watch our weight, our fat intake in our diet, stress levels, blood pressure, exercise minutes, etc. So again, before menopause, our heart disease rate is 1 in 7 versus after menopause, it definitely rises to 1 in 3. So if you are diagnosed with low testosterone, and if you do seek testosterone replacement, especially with a natural testosterone hormone therapy, you will notice that it will give you a lot of positive effects because it protects breast, your prostate if you're a man, brain, heart, and bones. So definitely testosterone replacement is very important. So let's talk about estrogen. So estrogen is present in both men and women, but of course this hormone now is more abundant in women's bodies and very small amounts in men's bodies. It has over 400 functions of the body, most notably that of cognition, maintaining memory, hot flashes, bone density, skin, and maintaining beauty and your skin thickness. Again, the positive effects of replacing estrogen, if you are estrogen deficient, it does protect the breast, brain, bones, and heart. Again, it just helps bring back that good well-being that we have. You have decreased hot flashes, you have better memory, you have better skin, and it also helps with the heart. So it lowers bad cholesterol, etc. So as I just spoke about hormonal imbalances, what can we do about it and what is out there for us as patients and doctors for us to use? So there's different forms of hormone replacement for hormonal imbalance. So I always tell my patients, how do you treat a hormonal imbalance? With hormones. You don't treat it with antibiotics. So that's why we're going to talk about hormone replacement for the rest of this talk. There's 2 kinds of hormones, though, that you could be prescribed by physicians. The one on the left, I hope no one is prescribing this anymore. These are the synthetic hormones. They're just not they're not the same as what the body makes, and they do not They are not as beneficial as bioidentical hormones. But thank God there are now bioidentical hormones in different forms for doctors to use, most notably pills, patches, creams, or pellets. So talking about synthetic hormones, I need to talk briefly about the Women's Health Initiative in 2002. This came out right as I was ending my training as a OBGYN. And unfortunately, it made me have to rethink everything that I was taught about hormones. This was a flawed study from the start. And so a flawed study will now give flawed results. They were giving Premarin to patients. Premarin, if people don't know, is actually horse estrogen. So we're not horses, but that was what the pharmaceutical industry thought women needed for their menopausal symptoms. And so when you give Premarin to women, especially if you add Provera to it, which is a synthetic progesterone, it caused a lot of bad side effects. It increased strokes, heart attacks, breast cancer, blood clots, and Alzheimer's disease. The results were so bad that they had to prematurely stop this study. So what happened was there was such a big blowback after all the results were released that women just stopped using all of their hormones. And unfortunately, this was a big disservice because many women were left with no alternatives for their hormonal imbalances and for their symptoms. So they should have still, we should at least given them the message that, yes, you shouldn't be taking Prem Pro, but there are other alternatives out there. So again, let's go through the different forms of hormonal treatments. The first one is patches. This is convenient in a way but there are a lot of flaws with this method. The benefit is that the estradiol levels seem to be better with patches versus pills, but not as good as pellets. There's a problem with adhesives. So if you have a patch, it may not stay as long as you need it to because you need to change it once or twice a week. So therefore, if your patch is not sticking, you're not getting that full benefit for the days that you need it to. It is associated with some weight gain, but less fluid retention. But 45% are just not of people just cannot absorb hormones through the skin. This is just a genetic thing. Nothing that they've done, but it's just that skin is not a good form for them to absorb medications and hormones through. The second alternative is creams or gels. This is even more inconvenient, I feel, than the patches because there's just too much guessing. Did you apply enough? Did you apply it? Did you rub it in right? There's a short half-life in these gels and creams because you have to rub it in 1 to 2 times a day. So it could be inconvenient. And it can actually transfer to others. So it can actually rub off on kids and pets. So it's not just you who's getting the hormones. You can actually pass it on to others because if they hug you or if they touch you while the hormone is still on your skin and hasn't been fully absorbed yet. Then lastly, the reason why creams or gels are not ideal because the component to most of the creams is called estriol. And this has been shown in studies to not protect bones, brain, and heart. Third way of getting hormone replacement is through injections. This is usually for testosterone. And it's usually an injection once a week. Usually men do this. There's an uneven absorption and there's a significant roller coaster effect, meaning that when you inject it once a week, there's a big bolus of hormone that immediately enters your body. So you feel great, and then it just gradually declines over the next 7 days. So your body is like going through like this roller coaster of benefit, then no benefit, benefit, then no benefit. So it's just not ideal. 99% of injections are with synthetic hormones or synthetic testosterone. And then, yes, you might feel a little bit of benefit, but overall, there's a lot of bad side effects, meaning liver toxicity and heart disease, and it's very bad on the cholesterol parameters. So it's just not an ideal method. So the fourth method that I want to talk about is hormone pellets. And this seems to be a great solution for men and women. So BioTE method, although they are not the only hormone pellets out there, they are definitely the number one most popular, and there's good reason for why they are the most prevalent of pellet providers here in this country and around the world. So what is the BioTE method? The hormones that BioTE is trying to balance are testosterone, estrogen, and also we're also trying to achieve thyroid balance. And also BioTE has also is incorporating medical grade nutraceuticals to improve the results from the pellet hormone replacement. So we'll talk about that later. So bioidentical hormone pellets are derived from plants, most notably yams, and they are bioidentical, meaning they are the same molecular structure as hormones that us humans make. So again, we have that lock and key analogy from earlier. Pellets last longer than other treatments, meaning that one placement of pellets can actually last up to 4 to 6 months. It is the most widely studied form of hormone replacement therapy, and it provides a steady stream of hormones in your blood. So again, it's actually been around for a lot longer than most people actually think. They think it's a new thing, but there's actually a study in 1939 about the use of pellets in radical hysterectomies, and a follow-up study about estrogen and testosterone pellets in 1949. So again, if you were to look it up in PubMed, there are over 80 plus years of use of and studies in the United States and in countries all over the world about the use of bioidentical hormones through pellets. This is a very important slide, and I think this is the slide that kind of convinced me why I will go with BioTE. So let's look at the purple line and oral hormones. So when you take a pill first thing in the morning, your hormone level goes immediately up. So again, I'm following the purple line. And then throughout the day, you start metabolizing it, you start using it up. And then the next morning you take another pill and then it's used up. So it goes up and down, again, like a roller coaster, but it's a smaller roller coaster compared to the injection roller coaster I was talking about. Then the second line is the patch line. Let's look at that. That's the orange line. So again, patches are usually prescribed once a week or twice a week. So when you first place a patch on, so as the orange line shows, you gradually start absorbing the hormones through your skin. But then again, remember, 45% of people just genetically are not programmed to absorb much through their skin. So this orange line may actually not even be applicable to about half of the population out there. So the orange line shows that the hormones from a patch are absorbed over the first couple of days, and then you finally reach good levels, and then sure enough, it starts bottoming out, and then you have to start then you're putting on the next patch again. So if anything, you only have a good hormone level maybe half of the time that the patch is on your skin. And then lastly, the line for the implants, or the green line, shows that when the implants or pellets are implanted into your body, you have a steady stream release of hormones over the next few months. So again, you will have all the beneficial, all the benefits of your hormones in a steady state dose over the months that you have it. So what is the BioTE method? The goal is to help return or restore your normal hormonal balance and physiological state. And they do this by providing, one, the right kind of hormone, which are bioidentical hormones and not synthetic hormones, the right amount of hormones, meaning that every dosing of BioTE is individualized for all people. There is a complex algorithm that we use where we put in the your symptoms and your lab values to give you your own individual dosing. And then lastly, BioTE does it by doing it through the right delivery system, which is pellets. So what is BioTE method of pellet therapy? It's safe and evidence-based. So again, there are hundreds of studies on pellets with 80+ years experience, and it's used all over the world. It's clinically effective because we achieve even levels of hormones for months on end. There's no roller coaster effect, and you will feel those benefits of natural testosterone and estrogen replacement. There's increased compliance because it's only implanted a few times a year, low side effect profile, and we will go through the benefits of BioTE on breast, bone, and hearts in a second. So again, if you want to remember, it's all about protecting your breasts, bones, brain, heart, and therefore your relationships. So breast health. So this is pretty much the number one concern that I hear from women when I start recommending hormone therapy. Like, what is the chance that I'm going to get breast cancer in the future? That seems to be like the number one question. And I would like to tell everyone that there are answers for you. There are actually hundreds of studies out there on the benefit of hormone replacement in breast cancer patients. So the studies can be summarized as follows. Testosterone delivered by pellets do not increase the risk of breast cancer. Testosterone implants actually are shown to have less stimulation of breast tissue. Treatment with testosterone and estradiol implants do not increase the risk of breast cancer. So again, do not increase. So let's talk about this particular study. It was in 2001 in the Journal of National Cancer Institute. This is the study title, Hormone Replacement Therapy After a Diagnosis of Breast Cancer in Relation to Recurrence and Mortality. So it was in over 2,700 people studied over this 27-year period. Breast cancer recurrence was about 1/2, 17 per 1,000 person years in women who used hormone replacement therapy or HRT versus 30 in non-users. Breast cancer mortality rates or death rates were 5 versus 15. So that means it was 1/3 in users versus non-users. And just overall total death rates were 16 per 1,000 years in hormone replacement therapy users and 30 per 1,000 in non-users. So yes, I did just read this slide because I want the numbers to speak for itself. I don't want to confuse it. It has been studied and it has been shown to be beneficial. So the conclusion of the study, if you were to look it up, are as follows. The results suggest that hormone replacement therapy after breast cancer has no adverse impact on recurrence and mortality. So, bone health. So again, pellets are noted to be the best method to increase bone density in men and women. Osteoporosis is definitely a problem in postmenopausal people. So pellets show a 4 times increase in bone density over oral estrogen. So here are the rates. There's a 1 to 2% increase in bone density if you use oral estrogen. If you were to start using patches, your bone density increases by 3.5% per year. But if you were to use pellets, they noted a bone density increase of 8.3% per year. So again, just looking at these numbers, pellets have a 4 times more advantage over oral estrogen and a 2.5 times more advantage in bone density increase than patches. Talking about bone health real quickly, estrogen and testosterone replacement can stimulate precartilage cells, so hopefully possibly reversing arthritis in people. Brain health. Alzheimer's disease is something that we all dread and we hopefully will want to avoid in our futures. So again, talking about women's health, Alzheimer's disease is just more prevalent in women than in men to a ratio of 8-1. Women on estrogen replacement therapy are noted to have 50% less likelihood to develop Alzheimer's disease in their lifetimes. And then on the flip side, men with low testosterone are noted to have a 3 times more likelihood of developing Alzheimer's disease. So definitely your hormones play an important part for your cognition and your brain health. Heart health. So this slide will show, we'll go in further about the benefits of hormones in our heart, in our hearts. Estrogen replacement with pellets has been shown to have positive effects on body fat in postmenopausal women. So again, women, we're always concerned about our weight gain after postmenopause. And so of course, if we do gain weight, we're always worried about our cholesterol. So estrogen replacement is shown to decrease total cholesterol and LDL. So a quick way of remembering which cholesterol is good and bad, I always say Dr. Oz, I heard it when I was watching his show one day, he describes LDL as lousy cholesterol. So that way you can remember that LDL is the bad cholesterol. And then he described HDL as healthy cholesterol. So HDL is the beneficial cholesterol that we would like a higher number of. So estrogen replacement decreases overall total cholesterol and LDL, increases the good cholesterol, HDL, and decreases triglycerides. This is bad cholesterol. And then if you add testosterone replacement, this does not negate or counteract the favorable effects of estrogen on our good cholesterol. So, and again, if you were to do a study review, many studies show beneficial effects of testosterone on our hearts. This slide is basically a duplicate of the last slide, that testosterone pellets are also, again, beneficial for men and their heart health. That testosterone decreases total cholesterol and the bad cholesterol, and it also helps reduce fat and improves lean body mass in men. So let's address the risks of pellets. So again, a lot of women will go, "You're putting this under my skin. What should I expect?" So these are the potential side effects or temporary concerns of pellet therapy. I would like to note, like in the title, these are usually on first insertions and not on subsequent insertions. And usually if you do develop these quote unquote side effects, they will be temporary. So let's go through them. Fluid retention. This is again most common in the first insertion. It's usually related to the testosterone in your body. So you will have some fluid retention, but so if you weigh yourself every day, you might note that your weight goes up slightly. It's not because you've gained fat, it's because you've just retained a little bit of fluid in the beginning. Remember, your bodies have been kind of deprived of testosterone for such a long time, so that when you're finally given testosterone, you might have a little bit of this fluid retention in the beginning. And because of that, you might note swelling of the hands and feet, especially in hot, humid weather. And again, less than 2% of patients will ever note this side effect. So going on with other concerns that can happen when you have pellet insertions, breast tenderness and nipple sensitivity. The next one, uterine spotting or bleeding. This seems to be the most troublesome of these side effects for those women who still have a uterus. So this is usually related to progesterone medication. If you do have a uterus and you have pellets insertion, you will need to take a bioidentical progesterone replacement, which comes in a capsule. There's no such thing, unfortunately, as a progesterone pellet. So if you have a uterus, you will be prescribed by your BioTE provider with a bioidentical progesterone replacement. Make sure that when you get prescribed, though, that this is not a synthetic progesterone that you are given. This is a must that you have to take if you do still have your uterus and you're going into your menopause years and you're receiving BioTE therapy. So we will talk about progesterone in a second. So in summary, BioTE hormone therapies, and from this talk, hormonal imbalance occurs in men and women. They usually occur during the ages of menopause and andropause, which is the 40s to the 50s, but they can be at earlier ages if you've had especially if you've had some chronic diseases, cancer treatments, or traumas in your life. Not all therapies are equal. I went through the different forms of hormone replacement, and as you can see, pellets are definitely the more superior of all these approaches. And hormone balance through BioTE is not a one-size-fits-all approach. We do give individualized dosing. So I just want to quickly say that I am not just a BioTE provider, but I am also a BioTE patient. So my statement to patients as we are all entering into our menopause is the following, that our role as Homo sapiens, or human beings, is to propagate the species. And so that now that I'm in menopause and no longer capable of reproducing, it's almost like nature has a cruel way of saying that you have now outlived your purpose as a human being. So there are no salvage mechanisms out there for my or our aging bodies. So that will help us if any of our bodily systems start to break down. So hopefully I want to live as long as I can. So hopefully into my 90s. So that would be, since I'm now turning 50, so that would be in the next 40 years that I would need to keep all of my capacities intact because I want to be around for my kids and for my family. So therefore, it is upon myself that I need to take steps to keep myself relevant and to keep myself healthy. So after a lot of research, I chose BioTE for my hormone replacement because the science just speaks for itself. This is a viable and convenient solution for myself and for which I can provide for my patients for their symptom relief. As I always say, as I always tell my patients, we are in this life together. So let's make this journey as pleasurable as possible and as simple as possible. So that's the reason why I chose BioTE. So if you are interested in getting started with BioTE, number one, you should please find a certified BioTE provider out there. They will provide you with a questionnaire to try to, so you could try to describe and quantify the symptoms that you are experiencing at this time. Then lastly, you should get tested for your hormones. Like the doctors say, don't guess, test. So when we get your lab results, we will go over it with you and we will see what your numbers look like. And I just want to say that just because your numbers may still be in what's called the normal range of labs, it does not mean it's in the optimal range. So again, hormone replacements therapy tries to restore us to that optimal range of our hormones. So, and I just listed here what are some of the labs that we try to cover in the panel and what hormones we try to check. This is a slide about the BioTE core supplements. BioTE has now started is now providing a nutraceutical line created to support and enhance the benefits of bioidentical hormone replacement therapy. So there are hormones that I can, again, these supplements I can confidently recommend for my patients. And I have overall confidence that it will have in the supplement what is said on the label. A lot of times when you look at supplements, not all supplements are created equal. Just because it's on the label does not mean that it is what it's inside the pill. So be very careful about what you buy out there. So just don't buy everything willy-nilly. Really try to research where you get your supplements from. The core four of BioTE supplements are DIM, ADK, methyl factors, and probiotics. I just want to talk real quickly about DIM. There is a hormone, there is a supplement called DIM. As you can see, it's the first bottle here on the left. DIM stands for diindolyl methane. I hope I said that right. But basically, it is a compound found in vegetables, most notably broccoli sprouts and broccoli. And they block the conversion of testosterone to estrogen and just help with overall hormonal health. If you're having hormonal problems like hormonal acne, irregular periods, and of course, these postmenopausal hormonal imbalance symptoms, DIM is definitely a supplement that you should be taking. So DIM is a supplement that you should be taking if you do decide to get on BioTE pellets and or on other hormone replacement therapy. This is a must. So this is a must that you should be doing. And BioTE supplements can be purchased through the Dr. Diego website. So thank you, Luke. I think I've come to the end of my talk. Thank you, everyone.
Excellent presentation, Dr. Diego. Excellent presentation. I thought that was very well done. So we do have a couple questions here. The first one being, can you describe the procedure and is it painful?
Okay, the procedure is a lot quicker than you think. After we've gone through all of the preparation, meaning we've drawn your labs, we've done your questionnaire, we finally found out your dosing, and you came in for the actual pellet insertion, the actual procedure is less than 5 minutes. I think the most that you would feel is the unfortunate prick of the lidocaine to numb your skin as I'm doing the pellet insertion. So after that initial prick that most people will feel, it's usually a comfortable procedure, and a lot of people don't even know I'm done, and they're still talking to me, and I tell them, okay, you're done, and I put on the large Band-Aid, and then they go, wow, I didn't even feel it. So pain, I would like to think it's not a painful procedure.
Excellent. Can you talk about another follow-up question to that, the downtime after the procedure, what patients can expect?
Okay, so for the after the pellets are inserted, my instructions usually are to take it easy for the next few days, to try not to have any exertion, especially of the gluteal muscles. So these pellets, I think I forgot to state earlier, they're actually placed in the upper butt region, buttocks region. So I tell patients not to use their glutes other than normal walking, going upstairs, but not to do any excessive exercise like Peloton or marathon running for about 5 days after the procedure. So that's the only downtime that that I would recommend.
Excellent, thank you. And then the last question that we have is this procedure covered by insurance?
Okay, so BioTE hormones, this is a cash procedure, but we can use your insurance for the doctor's visits and the lab tests. So yes, I will try to use your insurance as much as I can. But the actual procedure itself is a cash procedure.
Excellent. And then actually one more question, and that
okay.
Can you discuss the benefits that you or personally anyone that you know have seen?
Okay, so these are now, okay, so talking as a BioTE patient, I've noticed that the improvement in my symptoms, it wasn't like a light switch, it was more like a dimmer, like a dim control light mechanism. My symptoms just gradually just got better over like the first couple of weeks. I noticed my anxiety was a lot less. Definitely the hot flashes and night sweats improved. But I just felt like just calmer and just more energetic. I slept better. I don't want to seem like, you know, like it was a total panacea to most of my problems, but it was. it seemed like a lot of my problems just became a lot less. And I was pretty surprised myself. Of course, going into it, I was quite skeptical, I guess as most doctors can be in the beginning, but I was nicely pleased and delighted with my benefits. So I hope, again, my results are not the same as everyone. I'm not trying to preach here, but I was, again, very pleased with the outcome and this with my first insertion. So yeah, thank you for asking, whoever asked that question.
That's great. And excuse me, that, unless there's any more questions, I think that covers it. Thank you so much for your time, everyone. And thank you, Dr. Diego.
Thank you again. Thank you, Luke, and thank you, BioTE, and thank you everyone for listening today.
Oh, you know what? One more point, Dr. Diego. If someone was interested in BioTE, what would be the appropriate first steps to go through?
Please, again, go on maybe the BioTE website and find a BioTE provider in your area. You're welcome to call us here in our office. And they will help you with the steps. You will fill out questionnaire and it all starts with labs. So I actually have had quite a few patients that after their labs were drawn, they were not, I felt, a BioTE or a hormone replacement therapy candidate at this time. So the labs will really definitely help guide the decision making. So that would be your first steps.
Absolutely. All right. Thank you so much for joining us, everyone. And thank you again, Dr. Diego.
Okay, thank you. Have a great day.
Bye.